My name is Mel and I'm 29 and from England. I have Ehlers Danlos syndrome, which was diagnosed at the age of 2, along with many of its associated comorbidities. As a child, I was often poorly and in hospital, and by the age of 9 I had my first major surgery, a spinal fusion of L4-L5. At the age of 12, all my joints started dislocating spontaneously. Years later, and I'm suffering subluxations of my lumbar spine on a daily basis, which I need help to push back. Fast forward to my graduation ceremony. I attend it on a stretcher as I'm bedbound and suffering up to 40 seizures each and every day, with severe headaches, needing oxygen and ketamine for pain. The clip of my graduation went viral and kick-started a fundraising appeal to save my life. Nobody could understand why I was having so many seizures which were non-epileptic, and I was left in limbo due to being too ill for an upright flexion extension MRI. The specialists in America also needed this scan before they could help me. As a last attempt, I contacted Dr Gilete and explained my desperate situation. He said if I could get there, he would assess me and fit a halo as an alternative approach. If symptoms improved in the halo, that would confirm a fusion would be helpful to provide permanent stability. And so my campaign to fundraise began.
Now to the story of a young Northumberland woman who has a rare degenerative condition that could paralyse or kill her at any moment. Melanie Hartshorn suffers from Ehlers Danlos syndrome, which means her bones disconnect easily. The 27-year-old has been offered the chance of life-saving surgery in Spain, but she needs to raise £80,000 to pay for it. Sharuna Saga reports.
It's a horizontal life in constant pain for Melanie Hartshorn. She was born with Ehlers Danlos syndrome, a genetic connective tissue disorder which causes her joints to dislocate.
My skull slips out a joint and compresses my brainstem.
Once the funds had been raised, I travelled via air ambulance to Barcelona to meet Dr Gilete and his team. A dynamic video x-ray was performed with a full team present, and I was rushed into theatre for the halo fitting, during which I had many seizures, and Dr Gilete spent the entire time applying traction to my skull while the rest of the team fitted the halo. It was decided I was too ill to leave the hospital and needed to stay as an inpatient and have surgery to fuse me from skull to T2, along with a decompression for Chiari malformation. After the surgery, I was able to sit up seizure-free for the first time in years. But it was discovered that I would need a second surgery for my lumbar spine to stop the instability and paralysis of my right leg, and also a tethered cord release. So more fundraising was needed.
Melanie now needs stability in her lumbar spine because she's able to sit with a brace and for a limited time. If we succeed having a fixation of the lumbar spine until the lower dorsal region, she will be able to sit, and perhaps in the future she can be standing and walk.
The second surgery and tethered cord release was performed, which was a fusion from T10 to sacrum. After this, I recovered well and travelled home. Just been busy since we got back, been busy with the little one, my niece, and baking and going to the park and doing arts and crafts with her and things, so it's been nice. Completely different, my memory and everything's better, and my concentration, and I'm not sleeping all the time, and obviously I'm still sore, but a lot better than I was. Totally changed my life, and they know it. They said I'm a new woman now, a new person, and they're really pleased as well. It was lovely. Going to the last appointment was really nice,
Mel spent years in here, completely bedbound, unable to sit up or walk, and suffering daily seizures. She was in constant pain. Today, the only thing in that bedroom, flowers and welcome home balloons, a milestone marked, and for the first time, Mel can now focus on the future.
We've got a team of carers we're busy interviewing, and we're going to get them all trained up, and then hopefully I'll be able to get back on the list for a bungalow, because I had one before, but then I wasn't well enough to live in it, so
going to try and do that again, get a wheelchair, and then I want to try and get some more experience in schools and get back to uni for teaching.
Mel told me her dream was to be able to bake with her niece now she was well enough to sit up. And bake they did. And the best bit? Well, eating them, of course. One of many moments they can now look forward to sharing together. Amy Lee, ITV News, Cramlington.
Fast forward to today. Over a year and a half later, my suprapubic catheter was removed and my bladder function has returned to normal since the tethered cord release. I can sit up unaided, no back braces are needed, my legs are no longer paralysed, my feeling and strength is still returning and improving every day, and most importantly, I'm still seizure free a year and a half later. My concentration and memory returned, so I'm able to spend time with my family, socialise, going on nights out, and even volunteering in a school twice a week with a view to doing teacher training at university. Dr Gilete and his team believed me from day one. They were kind and compassionate and caring. He spent hours with me the first time I sat up after the halo removal, as I was so nervous about having a seizure. So I'd like to say a massive thank you.